There is now such a thing as e-health, all possible through DOST's Lakbay Kalusugan. In this Science Nation exhibition, did you see or discover anything that would merit the greatest of respect from you?
There are several areas that we have made significant contributions. One is in the area of diagnostics. This is curative, but it also helps in shifting from curative to preventive because it's early diagnosis of dengue through a technology that we developed, the Biotech M, to our local sites. All of these are developed by local scientists. So it is the product of Filipino ingenuity.
Right.
In the area of diagnostics, so that's for dengue and for tuberculosis. In the area of nutrition, yes, we have actually, through the Food and Nutrition Research Institute, funded and they've developed what we call the nutritional supplements and support to address the problem of malnutrition, particularly in the young age group. Children 6 months to 35 months. And this is through the use of what we call Bigmo or the Bigas Mongo blend, which can actually be eaten by itself or it can be mixed with food. And in fact, we have some cooking demos, food demonstrations in our activity center.
So it's like a cereal.
Yes, and they also developed what we call a power bar energy bar. That would be of interest to you because that is actually a bar that is really a complete meal by itself. And another impactful area that we're doing now is using information communication technology to provide quality healthcare services to the most underserved communities.
Exactly.
That is our outcome, by the way. Outcome 6 is to provide quality healthcare to every Filipino through science, technology, and innovation. In terms of this e-health, we are now enabling through the use of information communication technology, harmonizing all of the registries, so health provider registries of doctors, patients, hospitals, so that you can make access your data anywhere you are. And doctors can access your information anywhere you are. And aside from that, we have the RX box, which is actually the device that allows the processing of data. For example, you go to a clinic, there's no doctor there, which is the case for most of our geographically isolated and disadvantaged areas. You just have a nurse or a midwife. It gets your BP, your pulse rate, respiratory rate, even ECGs. And if you're pregnant, they can actually monitor the contractions and determine whether you're on a term or about to deliver, whether your pregnancy is complicated or not. This information will then be sent through this device through a specialist in Manila or in a urban setting, because most of our specialists are in the urban areas. They immediately study the data and make the appropriate advice and recommendation to the healthcare worker out there.
And excuse me, but the RX box, is that a local invention?
Yes, it is a local invention by our local engineers and scientists. And because of that simple technology, we are able to provide important healthcare services and specialty care to patients in the far-flung areas.
How soon will we see the RX box in place in major healthcare centers?
Well, we have already put it in 40 disadvantaged areas from north to south, and we plan to have it in 100 sites in the Philippines before the end of the year, and in 1,000 sites by 2015. And our ambitious target is to provide every barangay, which is I think about 42,000, with this device, so that whether or not they have a doctor or a healthcare provider, they'll be able to access the best quality care possible.
Fantastic.